In May 2021, ServiceNow invited us to work with them on the digitalisation of a nutritional unit for a non-government organisation called Ndlovu, based in South Africa.
It's great to meet you in person because our organisations have been working together. But would you mind just kind of introducing yourself and the organisation you work for?
Yes, my name is Hugo Tempelman. I'm a medical doctor by background. I landed up in South Africa because for me it was a fantastic concept. So I found a community with 140, 150,000 people in a very impoverished province, which is called Limpopo, in an area called Mutse, and negotiated with the local tribal chief and with the local authorities. Give me a piece of land and I want to develop it, put up a clinic, and designed the clinic.
What inspired you to do that?
As a doctor you can do two things, and that is just try to assist in alleviating the medical problem where people come with. Yeah. Or listen in between the lines and say, why does that problem occur? We have, it's called Ndlovu Care Group, it got its name. Ndlovu means elephant in Zulu, and I thought for somebody who is so stubborn and wants to do it so differently, an elephant is a good protector. Yeah. The fantastic brains, thick skin, and feet where everybody is afraid of. So we could start with it. Now over 300 local employees. We're the biggest employer in the environment, and we have 4 pillars of activities. That is healthcare, childcare and youth development, community infrastructure, especially water sanitation programs.
The area we're working together at the moment is in nutritional units, and I guess that's to do with your food security initiative. Can you tell us a bit more about nutritional units?
Nutritional units is a concept of the Ndlovu Care Group. Many other people, of course, work from the same principle out, but I do it from the medical perspective. The child comes in my consultation room and I see the diarrhea or the skin infection as an underlying cause of malnourishment. 1 out of 5 children in the townships of South Africa grows up with malnourishment. That means that there is going to be a neurodevelopmental backlog. That means that we are going to suffer later on because that the developmental status or the outcome towards what we want of our childcare and youth development programs, healthy, responsible, employable, is at the start of already impaired.
Yeah, disadvantage from the beginning.
Exactly. Yeah. So if we can change that, because a child comes to me with a diarrhea and I say, whoa, let's block that, let's solve that little problem, but let's reach out into that family and see, why are you malnourished? Father not working, mother not working, 8 children in the household, no access to water, and often, more than often, going to sleep with an empty stomach than something in it. What are we doing? How can we change that? And the nutritional units from the medical perspective into that family changed the community, provided something. When ServiceNow and we all came together, FlyForm came together, I said, fantastic if you want to financially contribute, but you've got a head of knowledge which is on our side less available. And but I need you. So if I tell you the concept, can you assist me in data management, in setting up data systems, in see what we really intrinsically can mean for each other to provide that change. And then we started working together on an app which is going to facilitate us to prove that we really create impact and we change the perspective of that life on long term, and so that we see those kids in the age of 2, 3, 4, and I want to prove that when they're 21 they reach a better outcome than what it has had been. For that I need data, and only access to data and proper and quality data allows me to prove my point. If I can see and if I can show you that the impact of that app is that we touch the life, can monitor that life and change the course of its life, and that finally your app developed, that we can say data led, and what we did with it to change that life into healthy, responsible, employable, instead of survival, early death, non-education and no perspective. Then data get a meaning.
Absolutely.